The world is forever changed since COVID-19, and not because of the virus, but because of how governments, global entities, and society as a whole responded to it. 5 years later, and what exactly is the fallout from lockdowns and other COVID 19 measures? And what does the once heavily censored science say about what we actually lived through? And how, in any way, can we prepare to prevent the same mandated trauma from happening to us again? An event taking place today, Thursday, 23rd, at the University of British Columbia's Frederic Wood Theatre seeks to answer those questions for the people. Drea Humphrey here with Rebel News, and if you still haven't forgotten the sting of medical tyranny we all experienced during the COVID era, and you want to make sure it doesn't bite you again, then you'll appreciate this interview I'm about to bring you, as well as likely appreciate the event that's connected to it. It's an event that will be hosted by the Canadian Citizens Care Alliance, formerly the Canadian COVID Care Alliance, a group of scientists and medical professionals that boldly released politically incorrect yet scientifically sound information regarding lockdowns and the COVID jab rollout, even though they knew they could pay quite the professional price for doing so. Attendees will watch a screening of the groundbreaking documentary called COVID Collateral, produced by journalist and Emmy-nominated filmmaker Vanessa Dylyn and featuring Dr. Jay Bhattacharya. They'll also be attending an important book launch for two books. One I'm about halfway through already, and they're called Down the COVID-19 Rabbit Hole and COVID-19 Pandemonium. They're the type of books that are jam-packed with truth, coupled with the evidence alongside it. The kind of books you're going to want to give to that family member or friend who maybe thinks you're still possessed with some sort of conspiracy theorist since back in 2020. The books are co-edited by familiar faces to Rebel News and the Freedom community, as well as some would say heroes. One is Department of Ophthalmology and Visual Sciences UB professor and neurological researcher Dr. Chris Shaw, and UBC Professor of Neurology and the Department of Medicine, Dr. Stephen Pelech. Dr. Pelech and Ms. Dylyn join me now.
Right out of the gate in 2020, it was pretty clear that public health measures were not making sense based on what we already know about the virus, which, was a fair amount of months in advance of that. But this virus was typically much like SARS-CoV-1. We had a lot of experience 20 years before with that virus, and another variant of that, MERS, in between. And when public health officials are questioning natural immunity, I knew we were in trouble. And so my thought was, with our lab being able to have the capability of tracking the immune response, that we would assist, the efforts across the country to do that. And then as we got more and more data, it became very clear that a lot of us already had natural immunity, even in the very beginning of the pandemic. The fact of the matter is the pandemic started months before, officially in March of 2020. We think actually even in November of 2019, we're already getting cases. So it was very clear to us early on.
This dovetails very well with what Dr. Pelech has just told us. We knew, I started noticing early in 2020, just after the lockdowns, that many scientists, there was a certain group of very brave scientists that were highly credentialed scientists had been speaking against lockdowns, because what they had been saying is, we have never locked down healthy people. There's not enough science to justify these lockdowns. And they were especially concerned about children in school, because they knew from early 2020 that children were not especially spreaders of this virus. And we now know the collateral damage that has been done to us all, but especially school children. We know that, especially parents, let's say, who were not of the laptop class. Many of us, the lockdowns were a major inconvenience, but to a whole group of low-income people, this was catastrophic because they not only lost their businesses, their children weren't supervised. Their children were lost.
What was happening in the scientific community, even when the vaccine came out, where even in that community, whether it's the journals or whatever, we seem to have only been getting one side of the story?
Yes, there's a tremendous amount of censorship, even at the editorial level of these journals, which actually receive a fair amount of funding through pharmaceutical companies. Many of the authors that publish are actually from pharmaceutical companies. So there's a lot of money. And of course, when we look at scientists across the country, in academic research like myself, they actually get funded through often government grants, could be charities, but a lot of it, the big money actually comes from pharmaceutical companies. So they endanger their careers if they speak out against some of these, the new vaccines. So there has to be a lot of enthusiasm. There's huge $100 million grants that are coming out now to support research on these new vaccines, these like we saw with COVID-19 with the RNA vaccines. So there's a lot of pressure for academics if they want to get promoted, if they want to retain their jobs, if they want to have funding so they can continue their work. They have to pretty much act within certain boundaries. And I think this is what we've seen. And it's very top down. We've kind of deferred to what we've been hearing from regulatory agencies that actually themselves are really getting their information more internationally than nationally. So we have doctors being trained, for example, in across the country in what we call continuing education, where the doctors that are presenting this information about these vaccines are themselves very strong advocates of these vaccines. So you're getting a very one-sided story. But as information comes out in the scientific literature, it's becoming very clear that these vaccines have serious problems. And as a consequence, the general public is not taking these vaccines. So there has to be a lot more accountability. And I think this is one of the reasons why we wrote these books, particularly the Down the COVID-19 Rabbit Hole. We want to do an appraisal of what was in the scientific literature itself and what did we learn from COVID-19 so that we don't repeat these mistakes going forward in the future.
I think one of the things we can do is we can do public presentations such as the evening on January 23rd. I think people need to meet in person. I think people need to read books, they need to watch films, and they need to engage in a kind of a public town hall exchange where people become informed about what happened to them and about what is necessary to avoid a repetition of what happened to us in January 2020. And because it's 5 years now since the start of COVID and almost 5 years since the start of lockdowns, we now have a lot of major studies. We have books such as Dr. Pelech's, and we have studies such as the U.S. Senate subcommittee report on COVID, which has been 2 years in the making. Last month, they released the report that basically substantiates what Stephen and I have just been saying, that the COVID lockdowns did not have a scientific basis, that the science around COVID had been politicized, and that we really have to ask our leaders. We must demand leaders, whether they are leaders of our educational institutes, medical institutes, government. We need to demand better leaders and much more transparent information. We need to hear dissenting voices in the in the public sphere.
At Rebel News, we don't back down from bringing you the other side of the story. That's why we are still bringing the public the truth behind the years of COVID tyranny we lived under. If you appreciate that we do that and want to be a part of what makes it possible, consider a fun way to do that. You can go shopping for yourself at our store called rebelnewsstore.com, and you can use coupon code DREA10 to save while you do.